When people look at what's happened in the United States in the last 12 months, they've seen governments do things all across this country that have never, ever happened in the history of the United States. And it scares them, and they have every right to be afraid. They begin to ask questions about past viruses that have swept through the world and this country. They go back and look at the Spanish flu virus in 1912, killed 500 million people. The smallpox pandemic virus that moved through had a death rate of 80% for children and 30% for everybody else. The swine flu had a death rate of 12%. SARS had a death rate of 10%. MERS had a death rate of 36%. And we never shut down one school, shut down one business, closed one church, or told people to go home and lock themselves in their house and cower in fear. But this virus that has a death rate of 0.4%, we did all that. And people don't understand why, and it scares them. And I think they have every right to be afraid. Then they ask questions about government. Does government have a constitutional authority to limit the movement and quarantine sick people? And most constitutionalists say yes, they do. Some say no, they don't. But then the question comes, does government have the constitutional authority to limit the movement and attempt to quarantine well people? And the answer is absolutely not. That's tyranny. And it scares people. And they have every right to be afraid. People understand that there are 4 circles of domain and autonomy in this country. There's a circle of domain for an individual in his self-autonomy and his right to self-government. There's a circle in the autonomy of the family. And there's a circle in the autonomy of the church. And then there's the domain of the state. And they saw states all across this country trample over the top of other sovereignty and have their will. They saw them move into the sovereignty of a church, even though people in this state know, and across the country should know, that the state's not the head of the church. Christ is the head of the church. Churches have their own government. They have their own bylaws. They have their own constitutions. And all across this country, people saw the state shut doors of churches. Thank God our governor didn't do it. Some had limited. You can have 10 people in there. There'll be no hugging. There'll be no handshaking. There'll be no choir singing and no special music. And you better stand 6 feet apart and wear a cloth over your mouth. They've never seen this in the history of the United States. To be honest with you, I was disappointed that pastors and preachers and elders and deacons and priests and rabbis and bishops did not rise up collectively all over this country and say, no, we will obey God rather than men. But most acquiesced, and it scares people. And they have every right to be afraid. They understand that when public health becomes the highest law, it sets aside liberty and freedom. When public health becomes the highest law, it is all-inclusive, because public health affects just about every area of your life, every man, every woman, every child in this state. It's all-inclusive. And when public health becomes the highest law, and liberty and freedom get set aside, then because it's all-inclusive, it's unlimited, which means the state's unlimited. And the state holds hands with the medical community, and they are unlimited in their influence and what they deal with every man, every woman, every child in this state. When they're unlimited, that means the only competency rests in the state and the medical community. All the masses are incompetent, which means all the masses are children. All children need a daddy. And the state gladly steps up, says, I'll be your daddy. It scares people. And they have every right to be afraid. So when they look down the road and they see a brand new vaccine come out in 5 months, that's never happened in the history of civilization. Nobody knows anything about it. They don't know how it works. They don't know what it does. I have 5 medical doctor friends that I correspond with just about every week. These 5 doctors say that it's a misnomer to call it a vaccine. It does not meet the definition of what Tennessee says a vaccine is. They say a more accurate term would be genetic modification or genetic therapy. But when people look down the road and see this come out in 5 months and see government push it, based on everything they have seen for the past 12 months, it scares them. And they say, when you get enough supply of this vaccine, it will not be voluntary anymore. It will be forced. And it scares them. So the purpose of this bill is trying to assuage some of that fear and try and claw back a little piece of constitutional integrity so that Tennessee people can put their head on their pillow and say, well, at least in this state, government, holding hands with police, cannot force me to take a medical procedure that I do not want. And there you have it.